with steroid, I remember you had shared a patient's query that some patient had taken Amala Chyawanprash, one of the very highly energy providing tonic, lack of strength, all those things very well. So you gave it to her, and she suddenly started feeling energetic. Within a week, so she started doubting on whether any steroid you have mixed or the company has mixed. So wherein your response was that let her come to me. I mean, let her send the. I mean, she was threatening that she is going to send the Chyawanprash bottle to laboratory for steroid test. And you were like relaxed because you did not mix anything. You just prescribed, or from the right from the shelf, and you were just relaxed, and you're telling that let her go to the this one lab, and if it is tested positive for steroid, then I am not responsible. I am totally relying on the company information. So it will be a headache between the manufacturer and her. So this kind of transparency and this kind of confidence is required. Like if we start doing our own things, like I mean herbal mixture on our own, especially when we are not revealing what it is there, and suddenly nowadays patients do a lot of testing on their own, and laboratories are quite open and available to everyone. If they go and test, and if they find some certain chemicals, then we will be answerable. The practitioner will be answerable.
Definitely. See, nowadays, even people, if you give a powder, they can, if they find instantaneous relief, they will go and check for the steroid levels. Sometimes, even some powders of our Ayurveda may give rise to steroid positive results. But we need to understand that a synthetic steroid is different from a natural herbal steroid which is available in the plant, because if you are giving any drug containing kantakari or something like that, there may be a natural steroid present in the drug that may be there. So we need to understand that. Of course, the tests are also very specific nowadays. Very clearly, it gives out whether it is a synthetic steroid or a mixed one, or it is an very natural one. Everything will be ruled out, and very clearly they give a results. So nothing to worry about these things. If anybody is having any, even many times I make a thing in the earlier in my practice times, as you mentioned 2002 and that time, when a patient, if they say that about anything result which is instantaneous and they feel that there is something, then I say, you please go and check. If you find any steroid in the drug, whatever the amount you have spent on examination or investigation, I will pay for it, and I will stand along with you to sue that company on behalf of you. Then that is a confidence level, because whenever I select a drug, I select from a reputed companies where I believe that they have done a very standard and ethical way of manufacturing. So I don't mind. We should be very open to these type of things in practice. If you are quite confident on your practice and your what you call the strength of the prescription, then no need to worry about all these things. And of course, but if you give it to something which is not labeled and something mixturing of 2 to 3 things, and that is there, then always be ready to face the blame that you are mixing steroid or something like that.